Femi Okay.
And I'm Malika Bilal, and you're in the stream.
Today, family planning, what makes the topic so controversial in some African nations?
We'll explore the issue of family planning on the continent with the help of your comments and your questions. So send them to us live on YouTube or via Twitter.
Reproductive health organizations in some African countries say they are improving maternal health and empowering women to have greater freedom in their lives to decide when they want to have children. One UN-sponsored initiative has a target of getting 120 million women and girls, particularly from Africa, to use contraceptives by 2020. Family planning can refer to a wide range of services, including sex education, the promotion of ideas like child spacing, greater access to birth control pills and implantable devices, or even elective sterilisation procedures. But not all Africans welcome family planning programs, which are often funded by foreign governments and outside philanthropy groups. In today's show, we want to understand some of the challenges in promoting family planning ideas in African countries.
And joining us to discuss this is Obianuju Ikiocha. She's a biomedical scientist based in Birmingham, UK. She's also the founder of the organization Culture of Life Africa. In Nairobi, Kenya, Karen Kaz-Lucas. She is the host of the sex and sexuality podcast, The Spread. In Philadelphia, in the US, Alex Iza. He's a professor of global health at Drexel University. And in Douala, Cameroon, George Winkar, the regional director of Human Life International. Welcome to the stream, everyone. I want to start thank you. Thanks for being here. Looking forward to this conversation. I want to take us first, though, to Kigali, Rwanda, where political leaders, scientists, policymakers, and more are gathered for an international conference on family planning. And one of those participants is Simon Cook. He's the CEO of Marie Stopes International, and that's an NGO that provides contraception in countries around the world. And here's what he told the stream about his work.
Well, for us, it's not really a debate. We really focus on providing what a woman wants. There's a huge unmet need for contraception in all of the countries where we operate. And we really rely on information and education, counselling, and then providing that method of contraception. And we really leave the debate for others. There are some that oppose contraception, but that's really not the interest of the women that we serve.
Obianuju, he says he provides what women want, saying there's a need there. What do you make of that?
It's quite easy for Simon Cook, an Englishman, who has had quite a lot of work done in Africa with regards to contraception, to be able to speak in this way. But one thing I know for sure, especially with the work of this particular organization, Marie Stopes International, is that they come to African villages and cities and perhaps urban areas. They give contraceptives to women, and they do not bother coming back to check women and do medical checks to know if there are things like side effects for them to deal with. So just Marie Stopes particularly, and some of the other Western organizations who do their work in Africa are leaving in their wake quite a lot of damaged women, quite a lot of women who don't now have recourse to any kind of medical care with regards to side effects. I mean, we see things like blood clots, we see things like weight gain, depression, all sorts of things associated with contraception. It's not enough to say you're bringing contraceptives to African women. We want to know exactly what the backup plan is with regards to things like health hazards that happen with contraceptives that are brought in by organizations like Marie Stopes International.
Kaz, go ahead.
I was going to say, I do agree with certain aspects of what you're saying, but with regards to healthcare, we are in a lot of African countries, we're already suffering when it comes to healthcare. So people don't have access, both financially and even physically, with regards to distance, like how close these healthcare facilities are to them. So already we're struggling with healthcare. So I don't think the bringing contraceptives into the country is a way, like them not checking back on us is a way that I don't find it a very strong argumentative point with regards to
it is
healthcare.
Actually quite a strong argument, especially because where you say that the women are coming in from far and wide, they're coming from places where they don't have have even access to doctors. What happens to them then? What happens to them when they end up with blood clots that could in fact be fatal? And then women are dying. There is absolutely no liability. And then there is no legal cause of action for African women. They don't tell us who to sue. But then when you come to Europe, a woman uses a contraceptive drug or device. They are able to sue the drug company. They are able to sue the person, the healthcare professional who gave it to them. But Marie Stopes International particularly is leaving in their wake lots and lots of women, and there is absolutely no cause of legal action. We don't know who to sue. We don't know where to go to. There's absolutely no report.
I just want to go to the Professor Alex, because he comes from the perspective of global health, and we don't have Marie Stopes International in the conversation live. So I actually want to ask Professor, what do you know about the duty of care to women who are receiving birth control in various African countries? You won't be able to name specific examples, perhaps, about bad care, but what's the level of care after women have been given contraceptives?
Okay, I think it's important for us to actually look at what are the issues that we are dealing with here. In the first instance, we need to isolate the issues. If we think about family planning services, the point here is not, we need to look at it as a comprehensive package. And when you have an effective family planning program, it should be able to address both the concerns of side effects and the potential side effects that might come, that family planning programs, when properly integrated within the health service delivery system, will be able to address all of those. There is a difference between that and making the point that indeed in many African countries, we still struggle with poor health systems that are not able to meet the needs of the people. And when you think about those poor health needs, the question is, does family planning programs exacerbate those existing problems? Or is it really helping to make a difference in helping women be able to achieve whatever their preferences and their desires are? So I would make the point that it is not the family planning program's responsibility primarily to ensure that we have effective health coverage. It is the government's responsibility in various African countries to provide for adequate health services and care for their countries. If we bring in the issue of which organizations, what is their responsibility, I think within in many settings in Africa, indeed, the family planning programs do offer much better services and quality care to the women that are receiving services in these facilities than what you would get in a typical health facility in many settings. So I'm not really clear what the point is. We're not going to say because there are side effects, which is not unique and specific to Africa, that because of those, women who want to delay childbearing or want to stop childbearing altogether should not be provided with the services they need.
I hear you. Let me just bring in George into the conversation. George, from your perspective, what is the need for family planning and birth control and these big programs coming into various African countries? What is the need right now, would you say?
Yeah, I mean, I am very, very clear that family planning is needed. But whether it is family planning as pushed and as delivered by the likes of Marie Stopes and International Planned Parenthood Federation, the answer for me is clearly no. Because basically what a lot of these organizations are doing are basically just pushing mass marketing goods and services that would either stop women from conceiving, or if they do conceive, that would stop the human person that has been formed from being properly implanted. Now, what is very, very clear to me is that this is not an isolation. The professor mentioned we should look at it as a comprehensive package. In the eyes of the family planning NGOs, a comprehensive package is one that ensures that the woman cannot conceive, and that if she conceives, the child has no chance of survival, and that even if the child survives, that abortion is available on demand, even in countries where it is illegal. I am talking here, there's a case hanging over Marie Stopes in one country. I'm not going to call the name of the country because it's still before the law courts and so on. But there is a repeated history of organizations, the likes of Marie Stopes, pushing encouraging, supporting contraception in countries where they are illegal. And a lot of these countries are in Africa and Asia. What is so attractive? What is so particular? What is so much in the need in Africa that we don't see anywhere else?
Oh, George, I can respond to that easily. And I want to make a difference here again between family planning, contraception, and abortion. And these are all different things. And I'm not sure that there are many countries in Africa, as George indicated, where family planning is illegal. And when you think about family planning, you've already underscored the fact that it should be a comprehensive package. And within that comprehensive package, I think it is wrong to give the impression that organizations that provide services to women are pushing a particular agenda.
They are, though.
No,
there's no question about that, Professor.
When you think about
absolutely are, Professor. They absolutely
are. The agenda there is to respond to the unmet need that does exist in many of our countries. And if that is an agenda, then it is something that we are already failing to do. It is not the companies that tell the women that they want to stop childbearing, or that they are interested in delaying the birth of the next child. The question is, when you have those instances, what do you do? An effective family planning program should be able to provide such a woman with the opportunity. And then when you come to that, the question then is, how are these
according to who, Professor?
delivered?
Effective according to who? Who
exactly
determines what is an effective family planning?
So, George, I hear what you're saying there. I actually want to bring in someone who might agree with you. This is a tweet we got from the handle is African Lives Matter. They say, I've been traveling all over most of the remote parts of this continent. Zero information is given to our precious and priceless people. They're sometimes coerced into it. African puppet governments working for nefarious imperialist NGOs to depopulate our continent. So that's one person's view on family planning initiatives, but I want to share with you someone else's view. Ngosa is out of Zambia, and she explains that the government has taken away some detailed information in schools, and so what's left when it comes to sex education is the very basics. Here's what she says is wrong with that.
And international organizations that have stepped in to supplement or to provide services are often hampered because they are unable to talk about abortion or provide services, and also talk about condom use. So what has happened is there's a lot of youth in communities, particularly those who have had early sexual experiences, often traumatic. A lot of girls who have had early pregnancies in their teenage years have started creating clandestine groups in order to provide a safe space for the younger ones in their community to be able to get the information that they need.
So Cash, she talks about the need still for a safe space for people who will want to access information and contraceptives. Can you talk about that need? And do you think that it is actually a significant need?
Yes, it's a very significant need. And I think the one thing that we all collectively agree upon is that there's a lack of education. And that's the reason why there's a lot of women who are not able to take action for some of the side effects that cause long-term side effects, like Uju was saying about suing companies. So I think the thing that is the most important is to be able to create comprehensive sexuality education in our school curriculum systems, and to be able to give people the information that they need for them to be able to make informed decisions about their bodies and what they want to do with their sexuality and their sexual reproductive health.
There were a couple of stories. Guess if I may show this to you, there were a couple of stories, headlines that Kaz sent to us to share with you. There's one here, and they're all from November. Shocking report of 14,000 pregnant school children in one country. Another headline here: teenage pregnancy becoming a national threat. Kaz, do you want to explain why you wanted us to share these with our guests?
Well, specifically, just like I was saying, there is a lack of comprehensive sexuality education happening. And so a lot of young girls are engaging in sexual activities. Some of it is not necessarily consensual. Some of it is statutory rape with people who are older than them. It's just sexual abuse, but they're not aware of what their different options are. So a lot of young girls during the national examination time, which is happening right now in Kenya, were hospitalized to give birth to their children, some of which are still sitting their exams right now in the hospital having given birth. And our health sector doesn't have any like viable solutions to be able to help our young girls. So we need to be able to give them education, and we need to be able to give them options with which they can make informed decisions about their body. I believe that every woman should have a right to decide what it is that she wants to do with her body, but based off of the information that she's given. And that's what we're lacking.
Uju?
Can I come in? Can I come in, please?
Sure, go ahead.
I think very often when the whole question of education is discussed, it is discussed as if it is some rocket science that has got to be brought to these ignorant Africans and Asians by these all-knowing Europeans. We have values. We have our own education system is not delivered in exactly the same way, and the role of parents is very important. Nobody is talking anymore about what the role of parents is in education. The education has now been totally handed over to the state. The state has subcontracted it to international organizations, and
That's
so
right.
the textbooks in our schools, in our colleges, even in primary school, are written, but with the help and with the influence of organizations that think a woman's body is totally her choice. I beg to disagree, and I know there will be many who would not agree with me.
Which is something
body
defined by the West, by the way. Which is something completely
You disagree
defined
that
by
a
the
woman's
West.
body is her choice?
It depends.
I
It depends
don't
on who is
disagree
saying
that
it.
it is her choice, but I also agree that if in the process of making her choices, some other human being comes into the picture, they become two people with rights equal in the eyes of the law and equal in the eyes of God. And I say this because I'm Christian. Now, you cannot, because it is your body, decide that another human being will have their own rights lost because you want to enforce your own rights. The rights of both parties have to be respected.
So, Judge, I think it's really important here that we do not get into the conversation on abortion, as you said earlier on, Femi, because it is important that we know that no woman ever gets pregnant simply because they want to experience an abortion. And it doesn't matter what your law says. Once a woman decides to do that, it doesn't matter what the law says. And the only thing we do with the law is to condemn them to a life of disability or death even.
So do you want us, Professor, now to discuss abortion? Because that would be great.
No, we are not.
I think that you jumped into it. We are not discussing it with an aside. So I'm going to bring us back, Gus. I'm going to bring us back to our discussion at hand.
I guess, Malika, the only reason I'm saying this because if you're watching this on TV or you're following this online, you may think that we are trying to center the conversation. Not at all. But when we're talking about abortion, that really needs an entire conversation by itself, and we're talking about family planning and birth control, not specifically abortion. We're keeping that out of this particular conversation because there's so much to talk about. Malika, go ahead.
So centering us back here, I want to bring in our community here with 2 points, opposite sides of this debate. The first is Ayodele, who says, I work with community clinics in Nigeria, and the simple fact is that adequate information regarding the side effects and contradictions in most of these contraceptives are not explained in plain terms to patients in clinics, and that's something I've heard from our guests today. But on the other hand, this is Ayo also talking to us from Nigeria. Ayo says there are radio shows sponsored by contraceptives companies in Lagos, and they give details on the various options available and the possible side effects. And I learned from these radio programs. We need more of it in northern Nigeria, though. Uchu, you're laughing there. There's 2 sides of the coin. Go ahead.
Because it's absolutely not true. You are putting something on radio. Who has access to that information? You might put something on a cable show. Well, who has access to that information? The fact remains that the hardest hit women are women from communities where they might not even have access to radio shows. They might not even be able to, go to the internet and find side effects. They are the hardest hit and they continue to be affected. But what upsets me so much is the culture of impunity with which international organizations, philanthropic organizations like Bill and Melinda Gates Foundation continue to deal with Africa without having any single consequence to anything that happens to anybody, especially the poorest among us who simply don't have access to that information.
Can I come in here? I think we really we need to be clear in the points we are making here. first of all, when we think about family planning, and we make the point that women, there are side effects. Almost every single drug that is sold in our countries, for whatever condition that you may face today, all have side effects. We have not gone to close down all the pharmacies and all the medical centers where these drugs are being sold. So the point I'm making here is that, are we going to say, because there are side effects, women should not use family planning programs, or that we should...
Professor, as long as women are told, as long as women are told when they are getting IUD that they could end up with a blood clot, for example, that could be fatal, then that's fine if they decide on it. But people are not being well informed on these things that the international organizations...
So, Professor and Uju, we return to the point that we started the show with, and I think we've addressed this point very clearly from your two different perspectives. What we haven't necessarily heard from are the voices of some women who are using contraception. I want to play this for you. This is a young woman. She's 17 years old. She lives in northern Nigeria, and she actually lives in an IDP camp. And she talked about the health services that she was given so that she was able to use birth control. Have a listen to her.
I decided to do family planning when it was introduced to me for the first time by the workers in the health facility at Bakassi camp. It has helped me to plan my life. My children now go to school because family planning has given me the structure to plan.
That was Toluta Buba, and she's a Nigerian teen. Kaz, we've talked so much about this really hot topic about whether there should be even birth control in various different African countries. But there are some programs, there's some young people, some older people who are finding it incredibly helpful. Can you talk to us about that, the positive impact?
Well, and I know that the discussion around abortion is something that that would take a whole different episode. But then a lot of the maternal mortalities in hospitals and growing from, according to some of the statistics from 2016 till now, a lot of the maternity mortality rates are really high because of unsafe abortions. And I feel like some of the positive aspects are just people are more educated and people can make more informed decisions about family planning, about whether they want to have children, but more specifically targeted towards young people, because I feel like that's where all of the education should be targeted towards. And Uju, I really do agree with you on some of the methods with which some of these medications and some of these contraceptions are introduced into our African countries. I agree that a lot of them do come into the country without enough information for people to be able to make informed decisions. But I feel like the way in which we can tackle that is to be able to give people the information so they can make the decisions.
I hear what you're saying there. I want to bring in one more voice. This is Kojo Loko. He's the Deputy Director for the Challenge Initiative. And he's speaking to us from Kigali, Rwanda, at that conference we mentioned earlier on family planning. Here's what he had to say.
20 years ago, when I started working in there was a lot of opposition towards the idea of family planning. But as the realities face folks and there was education around it, families and communities are embracing it. It's become a part of our life. And that kind of opposition, we do not see like I saw 2 decades ago. So I'm opposed really to the thought that this is a foreign imposition. This is it's just basic common sense. And I think it really borders on being a fundamental human rights of families and communities to be able to have the number of children that they want to have and when they want to have them.
So Uju, I just want our community to know, of course, that his project is led by the Bill and Melinda Gates Institute for Population and Reproductive Health, but he brings it back to the women and says this is what women tell them they want.
Yeah, of course he does. But let me just point out one thing. The event he's speaking from at Kigali, the ICFP, the International Conference on Family Planning, is an organization that has been held in Africa every other year, except 2 years ago when it was held in Indonesia. It is usually sponsored by about 25 organizations. And he's speaking about it like it's an international event, but it really isn't, because anyone can go to their website and check who the sponsors are. It is big pharmaceutical companies that have come from the West. It is philanthropic organizations that have come from the West. They are all Western organizations coming into African countries every other year to do.
And Kaz and George, there's so much to talk about, and we've done that in half an hour, and we've only just scratched the surface. Thank you so much for coming on the show and talking about family planning and birth control as a controversial issue in some African countries. Appreciate your time. Thanks for watching, everybody. Take care.